In this lab, we'll be discussing the anatomy of the spinal cord. Before we look at the inside, we want to take a look at some of the external features of the spinal cord. It's important to know that the spinal cord emerges from the brainstem at the level of the foramen magnum. If you remember, the foramen magnum was that large hole that we examined in the occiput bone. The spinal cord then goes down through the spinal canal, and it doesn't fill the entire spinal canal. It actually goes down only to the level of L1, L2. All right, so it's important to know that the spinal cord does not go down, through the sacrum all the way down the way we had saw the spinal canal went down that far. If we take a look at a picture from our lab book and our textbook, you can see the spinal cord starting up here where the brainstem is. Right here is actually the foramen magnum. Right here it's going through the cervical spine. They kind of colored it in blue, the thoracic spine, and then it just goes down into the lumbar spine. There's kind of this purplish area right here would be the level of L1, L2. Now, when the spinal cord ends, it doesn't end as a blunt end. It actually has a tapered end where it's more of a point. And we call that point, it would be right about here at L1, L2, the conus medullaris, right? Conus meaning that it's like a cone, like an ice cream cone. Right? So it's important to know that spinal cord goes from the foramen magnum in the occiput down to the level of L1, L2. It's somewhere in between there. And again, the name of the point where the spinal cord ends is called the conus medullaris. Now, along the spinal cord, all the way from the cervical spinal cord right to the conus medullaris, we're going to see spinal nerves emerging. And there's actually 31 pair of spinal nerves. So here on this picture, they're showing you, if you take a look over here, there's 8 cervical nerves. We'll see in a minute. 12 thoracic nerves. We can call them intercostal nerves. Right, we have then 5 lumbar nerves down here, and I guess there's purple, 5 sacral nerves, and then a coccygeal nerve. So again, you can see the nerve roots are all running down, but they're running down below the spinal cord. They come off around the conus medullaris. All right, so we have 31 pair of these spinal nerves. Now, there's 2 enlargements. One we're going to see, the other one on our model we're not going to see because it's covered by some meninges, but I do want you to know about them. In the cervical spinal cord, the spinal cord is a little bit enlarged right over here compared to, say, the thoracic spinal cord. The reason for that is this is where all the nerves are coming off to go down into our arms. You can see these blue lines right here. These nerves are actually would be heading right down towards the arms. All the shoulder muscles, our arm muscles, our forearm muscles. So the cervical spine is a little bit enlarged right here. We call this the cervical enlargement. A little bit above the conus medullaris, like right about here, where my cursor is moving up and down, that's where the lumbar enlargement would be. And then that's going to give rise to the nerves that are going to head from here down towards the legs, right down towards the lower limbs this way. So like I said, on our model, we're not going to see this lumbar enlargement because it happens to be covered by meninges. But we will be able to take a look at the cervical enlargement. So cervical enlargement, we're going to see, I marked down here that you're not going to see the lumbar enlargement. All of the nerve roots that come down off of the lumbar enlargement, when the anatomist looked at it, kind of reminded them of the back of a horse, looking at the back of a horse. So they saw all these nerve roots and they called it the horse's tail, which is the cauda equina. Right? So all the nerve roots that we're going to see on the model coming down from the lumbar enlargement and where the conus medullaris is going to be known as the cauda equina. Somewhere in the middle of all those nerve roots, there's an extension of the pia mater, which we're going to talk about shortly, comes down from the conus medullaris and anchors to the coccyx. Right? So it's going from the conus medullaris, the tip of the spinal cord, and it extends right down to the coccyx, and its job is to anchor the spinal cord, right? We wouldn't want the spinal cord riding up and down. That would do damage to all the nerve roots and the spinal cord itself, so it needs to be stabilized. Finally, the last 2 landmarks that we're going to look at, In the front of the spinal cord, there is a deep groove known as the anterior median fissure. This is a good landmark to look at so that you know that you're looking at the front of the spinal cord. We need to know the front from the back because it's not, things are labeled differently, it's not symmetrical. So we do need to know the front from the back. The anterior median fissure, again, is the deep groove. And if we look on the back of the spinal cord, there's going to be a shallow groove running right down the middle. That's called the posterior median sulcus. So actually, we go on a cross section, we won't see the anterior median fissure, we won't see the posterior median sulcus on this model. But if you look over here, let's take this one over here. This is a cross section of the spinal cord. So if you look in the front here, there's a deep groove right going up and down. We can see that at every level here. This is known as the anterior median fissure. And then back over here, there's a shallow groove. Right? My cursor is just kind of following it. That would be the posterior median sulcus. So here's our model, the torso model that we can see from the back. You can see the spinal cord extending from the level of the foramen magnum. It extends all the way down. Right here it's covered a little bit with some vertebrae and things and meninges. And then it's going to go down to here, right about where my cursor is. That's about L1, L2. So how do we know that's L1, L2? I mean, I labeled it, but how do we know? The way I would do it on an exam is take a look at the sacrum. Right? So we know this big bone back here is the sacrum. So the vertebrae above it, this is the transverse process of L5, L4, L3. Now we have L2, L1. If you look right in between here, there's a little point. And so I took a blow-up picture just to kind of show you. So sacrum, oh, this is the sacrum, L5, L4, L3, L2, L1. So you want to find that L2, L1. Now go right in between. You can see this nice tapered point right over here. That's the conus medullaris. Then from there, you follow straight down. It looks like it's letter C on this model. This middle filament right here, that middle line. This is going to go right down to the coccyx, and that would be the filum terminale. That's the stabilizing ligament, for lack of better words. It's actually an extension of a meninge. Then, if you notice, guys, all these nerve roots here coming down on this side, all these nerve roots here coming down on this side, if you use your imagination, looks like the back of a horse. So this is what would be the cauda equina, right, or the horse's tail. All these nerve roots here, and they're heading down, and they're leaving the spinal canal, a pair at a time as they're heading down towards the pelvis and to the lower extremity. Right. So on this lower section here, you want to be able to find the conus medullaris, the filum terminale, the cauda equina. Up on top, we have, again, the enlargement here, this little bigger urban area. This would be the cervical enlargement. Right, you can see here, here's the 8 cervical nerves coming off. If I go back one for a minute, here are the 12 thoracic nerves coming off. We also call those intercostal nerves. And then we can catch some of the lumbar nerves in here too when we look up close. Here's actually a picture or an x-ray of the cauda equina, the special imaging of that. The anterior median fissure and the posterior median sulcus, we want to take a look at that again. Always make sure you know the front from the back. So it's very easy. This deep groove in the center is the anterior median fissure. And then if you follow this brown line right here, that's that little dip, not this line going down here, just this little dip right over here. That is the posterior median sulcus. Sulcus means shallow groove. Fissure means a deep groove. So before we look at the inside of the spinal cord, we want to take a look at 3 protective coverings. These are known as the meninges. And sometimes you hear about someone getting a meningitis. This is what they're talking about. This is an infection of the meninges. There are 3 protective coverings we're going to look at. I'm actually going to do it from the inside out, even though our slide is the other way. We're going to look at the pia mater first. We're going to take a look at the arachnoid second. That's the middle one. And then we'll finish up with the dura mater. We'll go back to our model. This is the C5 cervical level. So all of this here you can see is the vertebrae. And we looked at that when we did the bony anatomy. Here's the body. Right? Over here would be the transverse process, this bone here, and this bone is the transverse process. And we have the lamina back over here, and then the bifid spinous process. So this should all be familiar, but on this model, the vertebral foramen is not empty the way we had seen it when we did the bone. Now it has the spinal cord in place, and then you can see the spinal nerve being formed over here, and the spinal nerve being formed over here. So back to the meninges. Always start at the spinal cord. The first meninge, this white line right here, and I have it labeled for you, is known as the pia mater. Right? Pia means delicate. Mater means mother or protector. So it's the delicate protector. It's a thin, almost like a saran wrap appearing membrane firmly attached to the spinal cord. Right? If you took a pair of tweezers or forceps, you would see that the pia mater, you couldn't pull it off the spinal cord. It's firmly adherent. The second meninge does not touch the pia mater. There's actually a space right here, and you'll see the second meninge is right over here. So right up over here, this is going to be called the arachnoid mater. Right here, when you look at if you were to look at this under the microscope, the arachnoid mater has all these extensions coming off of it. And it looks like almost like a spider's web. So the anatomist, arachnoid meaning spider, decided to call it the arachnoid mater. Then just laying on top, but now touching the arachnoid, it's actually laying on top. This outer membrane here, just below the yellow, is called the dura mater. Okay, so we have the three meninges, pia, then there's a space, arachnoid, and then laying right on the other side of that little brown line is the dura mater. Dura means like durable. It means tough, right? It's the tough mother, right? The tough protector. Here, if you were doing dissection, you grabbed it with some forceps, you would feel it's kind of a tough bag. We would have to cut it with a scalpel because it's so tough. Okay, so work those meninges from the inside out. Pia, arachnoid, dura. And again, remember that the dura and the dura and the arachnoid, they lay on top of one another. They touch one another. So now that we know the three meninges, we can look at three spaces. The first space, actually the first two spaces, are going to be above and below the dura. So if my cursor's on the dura right now, the space right above the dura is the epidural space. And you can see that space is filled with blood vessels and fat. Right? That fat is a good way to cushion the spinal cord. And we know that epi means above, right? Epi means above or upon. Right? So this space right here, above or upon the dura, is the epidural space. Sub means below. So this little kind of brownish line on this model here between the dura and the arachnoid is known as the subdural space. I put in your notes, that's a potential space. That should have nothing in it. It's just the two meninges laying on top of each other, just kind of like a bed sheet and a blanket would be laying on top of each other. That's the same thing here. There should be nothing in it. When somebody does have, some type of spinal trauma or head trauma, these three meninges also go around the brain. When somebody has some type of trauma, there can be bleeding into that space. And you may have heard of something called the subdural hematoma, where there's actually blood accumulating in that space. So normally it should be nothing. So I put in your notes again, it is a potential space. It should be empty. Finally, the last space is right below the arachnoid. So this big space right here, it's gigantic, is filled with fluid called cerebrospinal fluid. And this space is called the subarachnoid space. Okay, so again, on an exam, get your bearings. Start with the meninges first. Work your way from inside out. Pia mater, arachnoid mater. Then go to the other side of that line, dura mater. Then work your spaces backwards. Epidural space, The line is subdural space, subarachnoid space. Okay, so those are our meninges and our spaces. Now that we know the external anatomy and we know the meninges, we can take a look at the inside of the spinal cord. So when you first look at the spinal cord, you're going to see there's two shades of color. There's going to be a darker color, kind of like a butterfly or an H shape. This is what we're going to call the gray matter. So I labeled this slide for you, the gray matter of the cord. The gray matter is anything that does not have myelin. So things like dendrites, cell bodies, unmyelinated axons, neuroglia, they would all be unmyelinated structures and they show up as darker, so they are gray matter. Then we're going to look at, after that, the area around the butterfly or the letter H. This is going to be white matter. So all of this area here is the white matter. Let me actually change slides. So you can see here's the white matter. This is going to be anything that contains myelin. So predominantly it's going to be myelinated axons that are running in the white matter, right? And it has two different appearances. So let's take a look at the gray matter. So again, you need to know the front from the back. So just kind of verifying, always find your anterior median fissure. So we know this is going to be the front part of the gray matter, and then back over here is going to be the back part. Right? We don't want to get that confused. So this region right over here is known as the posterior horn. It would be on the same thing over here. I just labeled it on one side. So the posterior horn, this is where sensory information, we just took this spinal nerve here and we follow this yellow line back this way. This is where sensory information comes into the spinal cord. So the posterior horn receive sensory information from our spinal nerves. The bump on the outside here, and we can see it over here, these are the lateral horns. These give rise to motor nerves. That means they're going to go innervate some type of muscle or some type of gland in the body. These are specifically going to our organs. So we call these visceral motor neurons. But for today, this is just the lateral horn. So the cell body lives in here, and then the axon will go out and leave the spinal cord in the front of the spinal cord, and these fibers right over here. So this is the lateral horn, and it gives rise to our, what we call visceral motor nerves, and we'll learn in lecture, these are called visceral efferents. The anterior horn is right here. This is going to give rise to motor nerves also, but these motor nerves are going to go out the front here and go to our skeletal muscles. So we'll learn in lecture, this is going to be giving rise to our somatic efferent nerves. Okay, so the three structures you need to know for today, though, are the posterior horn, lateral horn is the bump on the side, anterior horn is the bump in the front. Now, the left side of the spinal cord needs to communicate with the right side of the spinal cord. So this crossbar right here going across, this is called the gray commissure. Right? Neurons are going to run across there to allow the left and the right side to communicate with one another. Then, if you look right in the center of the gray commissure, there's a little dot right there. That hole is known as the central canal. So there's a tube running right down the middle of the spinal cord. That is the second place that we have cerebrospinal fluid. Right, we saw it a couple seconds ago. Cerebrospinal fluid was in here. This was the subarachnoid space. This is the second place. Right? When we study the brain will have some ventricles that actually make the cerebrospinal fluid. That will be the third place that we have cerebrospinal fluid. Right, so that's the central canal. The next thing we want to take a look at is the white matter of the spinal cord. So like we said a couple seconds ago, white matter is going to be predominantly myelinated axons. There's three regions basically. In front of the gray commissure, the white matter in here is going to be called the anterior white column. And we actually use the term column. In the back, this is the posterior white column, and this would be the left lateral column. over here. And then on the side, this would be the right lateral column. So the neurons in here are actually running up and down the spinal cord. They're myelinated axons, and they would bring sensory information up to the brain, and the brain would send down motor information from the brain down into the spinal cord. So these neurons are not running in and out of the spinal cord, they're running up and down the spinal cord. We'll learn in lecture, these are known as tracts. But for lab today, we want to just know the regions. Again, posterior right column or posterior column. In the front, anterior column. On this model, they're on either side of the anterior median fissure. And over here, that's the lateral column on the left, and this one's the lateral column on the right. So those are our gray and white matter as far as the internal anatomy. The last thing I'd like to do for this lab is to show you how the spinal nerve emerges from the spinal cord. We had said earlier that there's 31 pair of spinal nerves coming off the spinal cord. So if we take a look, we'll jump right over here. Coming off the spinal nerve is actually formed by the union of two roots. There's going to be a posterior root. Again, we know this is the back of the spinal cord, so this root right here is the posterior root. That's going to form part of the spinal nerve. And then if we go to the front, these fibers right over here, these yellow fibers, and right over here, this is going to be the anterior root. So the posterior root always has sensory information coming in it this way. So sensory signals are going to come in, and then they come in the posterior horn. Motor signals, if something's going to be leaving the spinal cord, is going to be leaving this region here, and then the axons are going to come out and leave the anterior root. Right, so sensory goes in the back door, motor goes out the front door. It's always that way, right? Sensory in the back of the spinal cord, motor out the front. Okay, so it's important to know that the spinal nerve is formed by the two roots. I also want you to know one other thing. If you look at the posterior root, like right over here, it's actually swollen, it's actually expanded. That's because the neurons that are sensory, bringing sensory information into the spinal cord, the cell bodies don't live in the spinal cord. The cell bodies actually live outside the spinal cord in this big swelling right here. This swelling is known as a ganglia. We'll talk about this in lecture, but a ganglia is a cluster of cell bodies in the peripheral nervous system. So the cell body lives in here, and then the axon will bring the sensory information into the spinal cord so that it goes into the posterior horn. So you're always going to see a swelling in the posterior root. Finally, when the spinal nerve emerges and comes out of the vertebral column, the spinal nerve actually splits into 4 divisions. We're going to just take a look at 2 of them today. The first division right here, now this is the spinal nerve that's been formed, is the posterior ramus, right? A ramus is a branching. This branch of the spinal nerve is actually going to go to the back of the body, like the back of the trunk, and supply the muscles and skin on the back of the trunk. So you can see it's a small, relatively small branch over here. This larger branch is the second branch that I want you to know. This is going to go towards the front of the body and do like the lateral chest, the anterior chest, right, the front of the neck. But these branches are the branches that also go down into the upper limbs and the lower limbs. So you can see they're substantially larger. This would be known as the anterior ramus. Right? So the rami are the branches of the spinal nerve. The roots over here form the spinal nerve. We can't use those interchangeably. Right? Two different words. So again, the nerves that are coming off of the spinal cord, we need to know that there's 31 pair. Of them, there are 8 cervical nerves. Even though we only have 7 cervical vertebrae, we have 8 cervical nerves. The reason for that is the first cervical nerve comes off above the atlas, C1. So then when you count them down, there's actually an eighth cervical nerve between C7 and T1. So we have 8 cervical nerves, 12 thoracic nerves. And again, this is all pairs right there on both sides. 5 lumbar nerves. Then we'll have 5 sacral nerves. And the last nerve is called the coccygeal nerve. Right? So if we add these up, 8 plus 12 is 20, plus 10 is 30, plus 1 is 31. That concludes the lab on the spinal cord. The next presentation will be the plexi. We'll take a look at the cervical plexus, the lumbar plexus, and the sacral plexus, and the nerves that emerge from there.